Delighted to be here, and thank you for choosing this session, because although it doesn't sound very exciting, it is actually going to make a bit of a difference for you in practice, for those of you supporting student midwives, or those of you who are student midwives, or even if you are going to be a student midwife. So this is very important. And I've called it Beyond the EU Directive because obviously we left Europe over 2 years ago, and our programme standards have been for many years underpinned by that EU directive. And I bet all the midwives in this room, because me included, were actually trained reflecting the EU directive. But of course, with the leaving Brexit, we're no longer obliged to actually have that as being fundamental to our standards. So in 2019, in that autumn, we launched the new standards of proficiency for midwives. And we were very fortunate in having Professor Mary Renfrew, who led those standards. And she talked about transformative change. And what she meant by that is these standards absolutely are focused on the needs, views, preferences and decisions of women and the needs of newborn infants. We also at that time looked at our definition of what we meant by safety, and we widened that definition of that safety to be supporting not just physical safety, but also psychological, social, cultural and spiritual safety of the women and newborn infants that you care for. And the third one, which was also fundamental, was really recognising the importance of pregnancy, labour, birth, postpartum and infant feeding and those early weeks of life on those longer health term impacts for women and newborn infants and their health and well-being. We've got 17 interrelated themes running through these standards. And if I just pick out a couple of them, it's about thinking about how we use best evidence in our practice, as well as human rights. And you can see continuity of care and carer is actually fundamental to these new standards. And that was alluded to earlier, where we've actually put out a statement that that still is the case, so that students leaving the programmes will be proficient to work in continuity of care teams. So what does this all mean for when we left Brexit? Well, of course, the standards of proficiency were not necessarily based on the EU directive. That is based on high quality international and national evidence. But we also have programme standards, and the programme standards are almost like a briefing for what we expect the universities to adhere to when they develop their programmes and they roll out their programmes. But what we had really was this sort of mismatch between this very innovative set of proficiencies, contemporary language being used, based on high quality evidence, and then a set of programme standards which was still feeling a bit clunky because they had to meet the EU directive. So that departure from the EU really gives us an opportunity, although we just published the standards, to say, well, what should we do next? And as I said earlier, they'd been in place since the 1970s. We hold them very dear. This is what tells us that students have got to get their 40 births, their 100 examinations, all the things that you know that students are documenting and you're signing off. And the language is very outdated. Definitely doesn't reflect contemporary practice. It talks about hospitals and clinical training. It talks about deliveries, all the things that we've moved on. What was pleasing, though, is that when we looked at this piece of work, our actual standards of proficiency exceed what the requirement is. So we were fairly confident that if we were not aligning things to the directive any longer, that things were still covered and indeed exceeded. And our standards are outcome focused. So you don't find our standards saying how things have to be done. We talk much more about our standards of what we expect a midwife to do and know in order to join our register. Now, what was very interesting in this piece of work, and the nurses have done this work at the same time, but we've had our own midwifery group, and we did a lot of sort of desktop reviews of what the evidence was showing, and we went out to some stakeholder groups, we talked to them, what do you think we should do about this? In midwifery, there was very little appetite to do very much. And that wasn't because we were being a bit reticent or even complacent. It was because we had only just had these new standards in 2019. So why on earth are we thinking about changing them already when we haven't evaluated them? And the thing which really came out, although you might say, well, just because you facilitate 40 births, that doesn't mean to say you're proficient or even confident. But some students get that at 30 births, some need 50, 60. There is no evidence out there at the moment to say that we shouldn't do that. And that is the challenge. And indeed, there was also a voice that says, should we be misaligning ourselves in the UK to the rest of the world, who have actually, many countries have adopted that EU directive and even exceeded it. So it was very interesting, leading up that midwifery group, that they were very cautious in what we wanted to do. But we are going to do something. And the reason I'm sharing with you this today is really a sort of a headliner so that you can be alerted to the fact that we are going to consult on this next month. And I'll give you those key dates shortly. So at the moment, we have a standard which talks about what a student must have gained before they can gain entry into the organisation to undertake their midwifery programme. And that is that they have to do 12 years general education. So it's a very blunt instrument for the universities, really, to assess somebody's suitability for being a midwife. And of course, we have some very bright students. They can often come to programmes much earlier because they've met the A-level or equivalent requirements, or even people have homeschooled. So our new standard is going to actually put the onus on meeting the entry requirements which they set. The other thing is that we have thought about the practice learning experiences, and we feel that those are fairly sound because we obviously had looked at that in 2018, 2019, but we have retained those numbers. But what we've done is we've integrated it into the practice setting rather than having it as a separate annex. And the language now of the programme standards are much more reflective of the standards of proficiency. So a very simple example is we've got rid of deliveries, we are now talking about births. And there's some other changes which actually make the programme standards much more contemporary. Now, one of the standards which is new that we want to consult on is requirement for programmes for midwifery to have the opportunity for student midwives to go to different maternity providers. Now, if you think about these high-profile cases that are in the media at the moment, you will know that there are some units where the midwives have trained there and worked there and never seen any other maternity provider. And for very good reason, that people can't move or don't want to move. But we feel that in their midwifery programs, students need the opportunity to experience different maternity providers so they can see different leadership styles, different cultures, different ways of working. So we want to consult on that. We won't be saying how that's got to be delivered, but as you can imagine, for remote and rural settings, that may be some challenges, and they're going to have to think quite creatively of how that is actually achieved. But it is very common in a number of AIs that happens already, particularly where they have relationships with a range of trusts. So some might go for a year, some might go for a few weeks, but that is what we're proposing. And that's very much sort of aligning as to what's come out of Ockenden. So although that wasn't really an EU directive requirement, it was an opportunity to actually enhance that for the placements. Now, going back to those changes in the general education, one of the things that the midwifery group were very keen on was for us to consider that if you remove 12 years of general education, would that mean that more younger candidates would come forward wanting to come onto programs? Because if you like, having 12 years general education almost safeguarded you that they were probably around 17 on application, 18 when they arrived. And of course, in this change, it could mean that we could have, albeit few, candidates coming forward that could even be below 16. So we've needed to strengthen one of the standards in the Part 1 document, which talks about that we need to ensure that where students are admitted under the age of 18, that there are safeguarding measures. And I'll give you a tangible example about that. There are some universities that will not accept any students below 18. Others will, but they have some requirements that the parents have to sign various documentation for them to be on campus. There are some heads of midwifery that will not accept anybody in the maternity unit or theatre environment if they're below 16 or even between 16 and 18. So what we were finding is that there's variability around the country, and the AEIs will have to obviously deal with that if this is considered, that they will have to find a placement where they can be accepted, and a candidate who is younger may not be able to complete within 3 years because they may be able to not be able to do certain placements until beyond 18. So we hope that strengthen that so that the AIs with the placement partners will be really working together to say, can we safeguard these candidates? But it's not just the student. This is safeguards for women and newborn babies as well. So that's one thing. Now, our nursing colleagues are pushing towards being much more liberal in their approach to counting some simulation in practice hours. We were very clear from the midwifery stakeholders, including the Royal College, that they did not want this. That midwifery care, while simulation can be very, very helpful to prepare for practice, it can never substitute looking after that holistic nature of midwifery. But we have needed to refine our definition of simulation so it's across all our programs. So those are the changes, fairly small you might think, but important to make sure that they're up to date and what this means. And of course, one of the things was that people were saying that they wanted it to be evident where the EU directive was still displayed, so that for people who want to go and move abroad, they can be very transparent in what their programs had to offer. So our midwifery standards development group, which met several times before we came up with those proposals, has met again to discuss the position of all this work with the Ockenden actions. And there isn't anything particularly that is slightly misaligned. That diversity of placements and seeing different maternity providers actually meets some of those requirements. And it may be that we might want to enhance what we talk about in terms of the role of the midwife at the point of registration in our introduction, as well as thinking about preceptorship. But other than that, there are no standards changed. And Council was asked for their agreement to consult on the 26th of May, and they agreed for us to do it. So the consultation will commence on the 11th of July over 10 weeks. And you might think, oh, I don't know if this is really something that's very interesting, but it is important to have your say, because particularly for people working in practice with students, this does have a potential impact for you. Once the consultation is complete, we go back in and we actually consider everything, not just the quantitative stuff, but all the qualitative comments. We will read all of it to make sure there's nothing we have missed. And then, with a final report, we'll ask Council to approve in January 2023, which will give a lead-in time that the universities will have to adopt by September 2023.